I started dancing when I was, I think, 5, and it actually did look like I was floating across stage. I just felt so graceful, felt amazing to perform. My name's Katerina, and I'm a dance student. So I was in a dance class, and I was doing a somersault and hit my head. The next day, I was pretty nauseous. I would get a lot of headaches, so I went into Hartford Healthcare.
Katerina?
I was nervous about the possibility of my head not getting better, and then they set me up with a neurologist, Dr. Alessi.
My name is Stephanie Alessi-LaRosa, and I am the director of the Hartford Healthcare Sports Neurology Program. So I typically see patients who are ages 6 and up for sports-related head injuries or neurologic conditions in athletes.
Dance requires your body to be in basically perfect working order, every muscle being able to fire.
She was struggling with headaches, struggling with neck pain, struggling with dizziness.
I've had 2 concussions previously, and it wasn't getting any better.
There is a need for athletes to have a subspecialist within neurology, and it really can make the difference in how long it takes for them to recover. In her case, she really needed some good physical therapy with a real comprehensive approach, and we were able to pretty quickly turn her care around and really getting all of those things rehabilitated. Her outcome is very good.
It's wonderful being back and not feel like that, feel like my old self again.
There really is no better reward as a physician. We are able to get them back to their life.